McLaren Northern Michigan is a community hospital, but so much more. It really functions as a regional referral center.
The rural training track at McLaren Northern Michigan really seeks to bridge the gap where rural providers are in terms of our need. Northern Michigan, the Eastern UP need a significant amount of primary care providers. And we know historically, family physicians especially train and live locally. By offering a training program locally, we are going to be able to address the shortage of primary care physicians in Northern Michigan and in the Eastern UP.
There are 20% of our population living in rural communities across Michigan, but only 10% of physicians and providers are serving those residents. That's a really disproportionate gap that is unsustainable and not appropriate for patients to have to travel so far for care.
We cover a geographic area of 22 counties that filter their patients to us. So there's over 420,000 lives in this geographic area that depend on our service.
There just aren't enough physicians around. A town like Indian River could really use primary care. I've been here for 32 years now and have taken care of generations of families. Many times not any specialists for miles, and so we're the first stop, we're the front line.
So we get a lot of rural underserved patients who have advanced pathology. We also have kind of a transient summer population, which brings unique situations on multiple different aspects. But one is that we have a lot of seasonal workers from different countries who have not maybe had the best healthcare previously and sometimes show up with very advanced pathology that's very interesting and very good for learners.
The ability to work with a lot of different specialists one-on-one, and a lot of them are just newly recruited. The facility itself is brand new, really up and coming in technology, which is really rare for a rural health program. So I think that's a huge factor and a reason to come here.
The unique portion of this residency program is that they'll be able to live in a small community. Petoskey only has 6,000 permanent residents, but we have 1,500 plus people that work at the organization. They drive in from all over Northern Michigan to work here. And with that, you will have the opportunity to live, work, and potentially spend part of raising your family here in a rural community. And if you decide to stay with us, you will be able to continue your life in this very small town. The plus side of that is small town, but also we have tertiary level services. We're a level 2 trauma center, we're a STEMI center, we're a primary stroke center, and we have the most advanced oncology program outside of Southeast Michigan. You're not going to get that in any other town of 6,000 people anywhere across the country.
Petoskey is a wonderful community. There's a lot of young professionals here, really support each other and work together in the community. It's a really fun place to be. It's a beautiful place to live. There's always something to do in every season, especially if you love the outdoors. It's a small community feel, but I think there's a lot of opportunity for growth and a lot of areas to serve. When you're in a small community hospital, you get to do more because you're not behind multiple interns, multiple residents, fellows. You're the only one.
We will provide up to 5 months of internal medicine, sort of inpatient adult medicine, and then up to 5 months of elective time while they're here. And so we are going to reach out to the specialists that we need to make sure they can rotate with, like cardiology, pulmonology, or other types of core experience. So when you're in your private practice or in your primary care office, you're going to need to be able to manage, about 90% of what comes through your door. When you're in rural medicine, you can't just send everybody to a specialist every time they have this or that because the availability is not there. And quite frankly, primary care physicians, the reason we go through medical school and residency is to get that experience so that we can handle the common, both health prevention kind of topics, but also those acute illnesses that people have.
So I personally trained at an Unopposed family medicine program, and it gave me an unbelievable experience, and that has led me to be able to be here leading a group of 20 hospitalists as a family medicine trained hospitalist, which is pretty unique. I can speak from experience that being at an Unopposed residency program in a setting like this, you can get an amazing experience. So I want to give residents the same sort of experience that I had in an Unopposed rural referral center like this.
So one of the advantages of our program is that we are connected with the larger institution. The Flint program has a 666 program and has a number of faculty members who have a variety of clinical interests. And so during your first year, you're going to be able to expose yourself to a wide variety of clinical experiences, a larger group of faculty members that will share in the educational components and evaluation components. So we're really excited about using Flint as sort of the springboard to give some of the larger experiences in terms of a larger institution before the residents are up here and begin engaging with the more local, smaller town type feel that you're going to feel in a rural training track.
There's a lot of satisfaction in taking care of generations of families, and we use our full training. We're doing things with specialists backup, but we do a lot more, I think, than our counterparts do, where there's specialists on every corner. We work hard to keep our medical skills up. There's as much teaching as anyone would want.
Being in a rural area does not mean that you're excluded from all of the academic opportunities. We're able to capture that. The beauty of technology is that we still can reach out to those folks in bigger cities. For example, I personally didn't see a lot of variety in my residency, and I think having this combination where they're getting an urban experience, underserved experiences, and then also complementing that with what we have in a rural area, it just seems to me that we're going to see so much, and the residents are going to be able to really take that knowledge and move forward when they start their career.
It is an essential element to giving great quality care in this community. So having a family medicine residency program here aligns very well with our fundamental mission to serve our community.
Probably the most important thing that I would want a prospective resident to know after watching this video would be that we are going to be able to provide the education that they need in a town that they would love to call home when they're done.
McLaren Northern Michigan has a reputation for quality, and we provide service at a level that most other hospitals can't even think about competing with. We've twice been a top 100 hospital, 6 times been a top 50 cardiology hospital, and if everybody provided care at the same level as we do, 110,000 fewer people would die every year. I really can't think of a better organization better suited to train the next generation of physicians than McLaren Northern Michigan.